Why do simple, seemingly benign triggers lead to hepatic encephalopathy? Triggers are varied and can be as simple as constipation, dehydration, but can also be from more serious triggers that represent decompensation of cirrhosis, including infections or GI bleeds. Other common causes include overdiuresis, AKI, hypokalemia, alkalosis, and the use of sedatives or opioids. Let's work through the mechanism of why each of these may tip the patient into HE. Constipation worsens hepatic encephalopathy because it increases the intestinal transit time, which increases the time and substrate exposure for gut bacteria to generate ammonia and other neurotoxins, and allows for increased absorption of ammonia across the colon. Infections trigger hepatic encephalopathy not because it leads to the production of more ammonia, but because it lowers the brain's tolerance to the same toxin load. Inflammation increases the blood-brain barrier permeability and microglial activation. Together, these allow the same level of ammonia to produce a more significant cognitive impairment. GI bleeding is a classic precipitant because the gut treats blood essentially like a high-protein meal. Hemoglobin is digested into amino acids and nitrogenous substrates, which can lead to a rapid rise in ammonia and neurotoxins. Overdiuresis or dehydration reduces effective arterial blood volume and renal hypoperfusion, which can decrease ammonia handling and urea excretion. More urea and nitrogen is then available to be converted to ammonia in the gut. Hypokalemia leads to higher ammonia levels via stimulation of proximal tubules in the kidneys as part of acid-base adaptation. This activation leads to the generation of more ammonia. Metabolic alkalosis shifts the ammonia equilibrium toward non-ionized ammonia, or NH3. This increases diffusion of ammonia across the gut wall and across the blood-brain barrier, which effectively increases brain exposure. At the end of the day, all these triggers are just different ways of tipping a fragile system past its compensatory limit, either by increasing toxin generation, reducing clearance and buffering, or making the brain more sensitive to the same toxin load. This is why hepatic encephalopathy can look like it comes out of nowhere. The precipitants might be mild, but the physiology isn't.